Hi, my name is Keishina Francis, and I will be presenting to you Florida's Health Information Exchange. Highlights what Health Information Exchange is, and I will be referring to Health Information Exchange as HIE. Why is it important to healthcare? Who does the Health Information Exchange impact? Where does it fit into healthcare? How does it relate to healthcare profession? And when was Florida's Health Information Exchange introduced? What is Health Information Exchange? Health Information Exchange is an electronic exchange of health information across multiple networks. One example is making a doctor's appointment, going into that appointment, and your information is already in the computer system. Once you go into the room to meet your doctor, if you need a prescription refill, the doctor quickly enters that in one of the systems. That information is transferred to another network, which is your pharmacist, who fills the prescription for you. By the time you leave the doctor's office, you can go right and pick up your prescription. Users can access information from numerous databases, like an example I just shared with you, and the information is shared securely. This increases speed, quality of care, safety, and a decrease in cost. An example of a decrease in cost is not allowing multiple orders for the same prescription to be populated in the computer system. HIE is managed by Health Information Organization called HIOs. One example is the Agency for Healthcare Administration, other known as AHCA. Health information exchanges must comply to Health Insurance Portability and Accountability Act, other known as HIPAA. What is Health Information Exchange for Florida? First of all, it is located in Tallahassee, Florida, and the Health Information Exchange participants include hospitals, which are some of the local hospitals in the surrounding area, such as UF Health Shands, St. Vincent's, The Villages, North Florida, rehab facilities, clinics, medical insurance companies, and of course, our patients. Why is Florida Health Information Exchange important to healthcare? The most important services at this time in the Florida Health Exchange is notification services, which keeps providers connected to their patients. One example of this service was used to locate displaced patients during Hurricane Michael. Direct messaging services, which sends information securely via the email. Query solution services, which is a network of exchange of healthcare providers that securely share information about clinical documentation. So the information is queried by just using that specific information, and that information is populated. Who does HIE impact or affect? Patients. Doctors are able to review medical records prior to arrival to an appointment, increase quality of care, better communication between providers and patients. Another party that Health Information Exchange impacts is healthcare providers, who share the most up-to-date information between other providers, no matter what location their patients are seen at. Care can be tailored to specific needs and questions that the patients may have. Policymakers are also impacted. Policymakers are important because they put policies, procedures in place to decrease medical errors. And healthcare is more cost effective because of the policies and procedures that put in place. Where does HIE fit into healthcare? Everywhere in healthcare by way of health information technology. Health information technology is the hardware and the software, the network for managing health information, the mechanism used to improve patient care, and lastly, the application of information technology in healthcare. This is how the information flows from one place to another. How does Florida's HIE relate to the healthcare profession? Technology connects the electronic health records, which is other known as EHR. EHR is a digital version of the patient's paper chart and contains the medical information, treatments, and history. EHRs is made to be used for more than collecting information during an appointment. Advantages: up-to-date information. The HIE professional could quickly access the information, provide accurate diagnosis of patients, improve productivity, and also the sharing of electronic information from one healthcare profession to another. When was Florida HIE introduced? Florida HIE was founded in 2011 after being awarded $20.7 million in federal funding to be used over 4 years. Florida's HIE monitors exchange of numerous healthcare providers, including the ones I mentioned and much more. Florida HIE covers 9,000 patient beds, which is 20% of patient beds in the state of Florida. The most critical aspect of Florida's health information exchange and how it works is health information technology is its preparation, planning, and response in event of a disaster. Florida is extremely susceptible to natural disasters such as hurricanes, which results in leaving people's homes for safety, even evacuating to other states. During this time, a person may need medical care, and it is crucial that their medical records are accessible wherever they receive care. In event of a disaster, the Florida HIE is activated, and Florida doctors, hospitals, and other healthcare allied workers are able to share medical records whenever and anywhere in Florida and the surrounding states. Hopefully, there will never be a need to locate a loved one during any disaster. But more importantly, if there is a need, will the facility where they are located be an active participant of the Florida Health Exchange?